panel is a blood test. It's a way to measure your cholesterol. And a standard lipid panel includes 4 things, which is your total cholesterol, your HDL, which is what we used to call good cholesterol, but we don't do that anymore. Your triglycerides, which is kind of like the fat content in your blood that varies a lot with your diet and what you're eating. And your LDL, which is still the bad cholesterol. So that's what a standard lipid panel is. It gives us a lot of insight into people's risk for heart attack and stroke, because one of the biggest risk factors for heart attack and stroke is high cholesterol. Most people's cholesterol is mostly genetically determined, and actually only determined a little bit by your diet. Now, of course, there's outliers, right? Some people are vegans, and some people are really carnivore heavy diets. But for the average person, it's really mostly genetically determined. And so everyone in the US is supposed to have a lipid panel at least once by age 11. That's a pediatric guideline. And then, every so many years thereafter, depending kind of on what the prior blood test showed and what your family risk is, or family history. If your parents have had heart attack and stroke, you should get a lipid panel and see if that's something you are at risk for too. There's other kinds of cholesterol that we can measure as well that aren't included on a standard lipid panel. Some patients may have heard of lipoprotein little a or LP little a. It's kind of like a supercharged bad LDL cholesterol. It is genetically determined, and that can really increase people's risk of cardiovascular disease as well. Many people get lipid panels through their primary care doctor, or you can even walk into the lab here at Community and without an order, just get a lipid panel if you're curious or you want to have that data to discuss with your doc. And for general doc practitioners out there, we do have certain cutoffs that are like what's really concerning that would suggest referral to a cardiologist or a lipidologist like me, a subspecialist. Certainly if your LDL bad cholesterol is above 190, that's kind of wildly abnormal and usually suggests an underlying genetic cholesterol disorder. Yeah, certainly, usually whoever orders a test goes over that test with the patient, I would hope. And if it's me, you'll certainly hear from me. The first thing is usually lifestyle. Even though I said the most cholesterol is genetically determined, we usually say, look, we can eat better, we can exercise more. And to some extent, all those things are true, right? You always can try to do better. And then of course, there's medication therapy, right? And there's a lot of types of medication therapy, from statins, which is the most widely used medicine in America, to more kind of fancier, newer drugs that are injectable cholesterol medicines, of which we have multiple types. And I think we're the largest center in Montana using a lot of these drugs that are either injectable at home for your cholesterol or injectable in the office on a varying schedule. Some of them are only twice a year even, and have really amazing ability to lower your cholesterol in half. So I think the good news in the cholesterol world these days is there's never been more drugs available for patients, whether they need 2 drugs to get to a low level or whether they've had a side effect with 1 drug and want to try some different pathway. So lipid panel includes kind of 4 things, which is the total cholesterol, your HDL, the one we used to call good cholesterol, but we don't anymore, your triglycerides, which is the fat content in your blood, and then your LDL bad cholesterol. And so when you get your blood test results, those things would be written out. And I think an important thing to understand when you get your results, and this is why it's worthwhile discussing with your doctor, is because the lab printout doesn't know anything about your personal health. It's gonna say this is normal, high or low, based on a population of health. But you're an individual, and we want to know how these numbers affect you as an individual. If you're on a drug already, the lab doesn't know that. If you have a family history or you already have heart disease, the lab doesn't know that. So what they call normal, it has to be interpreted in the context of your individual health. And that's why, frequently the patients, they'll come into me and they'll say, oh, but my labs look good on paper, right? They said it was normal here. It's like, well, that's normal for a normal person. But if you already have heart disease, we have to treat you a little differently than the person who doesn't have heart disease. So always interpreting your blood tests in the context of your individual health, and that's where discussing it with a physician comes in.